Distal radial fractures are the most reported and treated injury in the ER annually. The break usually occurs 1 inch from the distal end of the radius. The most common way to get a fracture is by falling on an outstretched arm, also known as a foosh. This can also happen in high-impact sports such as football and even in vehicle accidents. Most common of all possible fractures is the Cole's fracture. This is where the radius bone has been pushed in an upward or posterior displacement. Anyone can suffer from a distal radius fracture, from professional athletes to pee-wee soccer players. Starting in phase 1, which is the immobilization phase, the patient would normally have a cast on starting from about midway down the arm, potentially a little longer depending on where the break was, all the way up through the middle or a little bit towards the distal end of the palm, and sometimes the cast will even stretch up onto the thumb a little bit to prevent movement here, to ensure that the radius bone is staying still so that bone union can occur. And with the main goal of this first phase is just to have the bone heal and for the swelling to go down and for the tissues to resettle. Exercise-wise, there's not going to be a whole lot. The most that can be done is extension and flexion and maybe some finger touches if possible. But with flexion, the fingers can move towards the palm, and with the extension, moving away, even expanding the fingers out a little bit for a bigger stretch. That may even be a little bit too much than can be seen. Normally doctors would tell the patients to be careful in this first part, not to bump or be too reckless so that way the bones can completely heal. However, moving these fingers, the flexor digitorum superficialis is activated, and the extensor index is activated, and the extensor digitorum is activated, and just to keep some movement in there so nothing becomes super stiff. Phase 2 is beginning movements and working on getting out of a splint. Not everyone goes into a splint after being a cast, but in most cases the patient does. The main goal here, working up to having enough strength to not need that constant support all the time. Starting with exercises to work on range of motion, grip, and wrist strength. So for some wrist strength, we can do some flat table waves, which basically you just wave side to side on the table, making sure that the patient does not do this movement at the elbow and that they're focusing on moving their wrist. The next one that you can do is supination and pronation at the elbow. We'll supinate by turning the palms up on the table and pronate by touching palms down. And for some fine motor movements, you can take a cup and some coins, and you start with pinching, so you use your thumb and your first finger, and then put it in the cup. And then just move on down the line with different finger patterns. Do thumb and the next finger all the way down. You can do a bunch of different variations here. And for all these exercises, you're going to want to do them at 5 reps of 3 sets. The muscles that can be targeted in this phase are the flexor carpus radialis, the flexor carpus ulnaris, the supinator, and the pronator teres, just to name a few. Phase 3, mobilization. The goal by the end of this phase is to have the patient at about 90% of where the injured wrist was prior to the accident. So in this phase, we can be a little bit more aggressive with the stretches, and we can start to increase weights. First, we can start by interlocking the fingers with thumbs facing up, and we can start with flexion and extension by using the uninjured hand to assist the injured wrist, You can flex and extend the injured wrist further than maybe you could on its own, just to encourage the range of motion and to get a really good stretch out of the muscles. You can also use this same idea with supination and pronation, using that good hand to assist the injured hand. If this becomes really easy, you can start doing supination and pronation using a dumbbell, or if you're at home, a soup can. Holding a soup can securely in your hand, and then rotating your hand over into pronation, and then back into supination. The added weight makes it a little bit more difficult, although it does not need to be super heavy as we are just starting in this phase. And by the time you get to the end of the phase, you can increase the heavier weight, you can use a weighted stick, you can get really imaginative with the weights that you choose for this. The muscles that will be incorporated into this are the brachioradialis, the biceps, and the biceps brachialis. These exercises should be done at 10 reps for 3 sets and twice daily. And if in any of the phases that you begin to notice an abnormal pain or a patch of swelling, grinding, clicking, anything weird, you need to immediately notify your doctor and get that checked out, because there could be a problem with maybe with surgery or with the progression that you're doing, and there's a chance that you could be doing the exercises wrong. So always go back and double check with your doctor, and especially with your PT/OT, if you're performing the exercises correctly. Phase 4, which is when we can resume play or resume normal life, depending on if you're a high-end athlete or just a little kid going into 4th grade. Here also we can see that the patient has now gotten a pillow. Sometimes throughout all the phases when performing these exercises, fatigue can happen, and exercising on a hard surface can become really uncomfortable. So to make the patient as comfortable as possible, provide a pillow or some sort of comfortable support. It makes them happier, and it encourages good exercise techniques and good strengthening. So in this 4th phase, where we are essentially back to almost full strength and full range of motion, if we're still working up to there, if there's a delay, which can happen, we can do some wrist curls. And we are going to start with wrist flexion, so you can place your soup can, or dumbbell would be more appropriate at this point because you'll be strengthening, but everyone is different. And with this, you're just going to rotate your wrist towards you, and then back down. This is your flexion. Good. And then you want to support the forearm. You can put your other hand over here just to keep that down. That way you don't want to go in and use your elbow, and you can focus on using just your wrist. And then we're going to go into wrist extension. So if you want to flip your previously injured arm over and go into extension by lifting your hand up towards your face. Again, supporting down on the forearm so that way you don't get tempted to use your elbow and the other muscles in your arm. Awesome. And then we can also do some ulnar deviation by holding the can so our thumb is on the top of the can, and you're going to kind of like snap the rein. So bring the thumb back to you and then put the rein back down. Yeah, good. Alright, the last one that we can do is going to be bouncing and catching a ball. This is like a bouncy ball, and this helps with focus and precision in gripping. There we go, precision in gripping, and encouraging flexion and extension in the wrist. One more. Good job.